you so much, Xiu Fang. Thank you. Thank you. Hi, everyone. Good evening. My name is Annie. And first of all, I would like to thank you, EVG Network. 1 second, right? Okay. Would love to thank you, EVG Network, and my uplines. I'm very happy to have this opportunity to share with you on this topic. Together, let's beat diabetes. I'm sure many of us have heard of diabetes. Diabetes is a metabolic disorder. It occurs when the pancreas does not produce enough insulin, or our body cannot effectively use the insulin that is produced. Let's look at the number, okay? What's happening in the world of diabetes? In 2019, okay, before I go into this data, let me share a little bit history about the number of people with diabetes actually rose from 108 million in 1980 to 422 million in 2014. So according to the data that we can see here, just in 2019 itself alone, diabetes caused 4.2 million of deaths. About 463 million adults have diabetes. And this data does not include about 232 million people who were undiagnosed. Scientists have predicted that by 2045, 700 million people will have diabetes. According to statistics, 11.3% of Singaporeans suffer from diabetes in 2010. And it is estimated that by 2025, 25% of Singaporeans will develop type 2 diabetes. So allow me to ask a questions. How do we determine one has diabetes? Right? You can, write your answer in the chat box. How do we determine? So the common method is, first of all, doctor can help us to diagnose by measuring the blood sugar level. Okay, so look at this picture. Okay, the normal and diabetic blood sugar levels. Generally speaking, to detect whether one has diabetes, it is to check the blood sugar level on an empty stomach. That is, for example, an adult has to be fasting for 8 to 10 hours. So a normal fasting blood glucose level is between 3.9 and 6 mmol. If the fasting blood glucose level is between 6.1 and 6.9, this person could have pre-diabetes. If the fasting blood glucose level is greater than 7.0 mmol, then this person could have diabetes already. So to be more accurate on whether one has diabetes, we can go for a further test, which is called this oral glucose tolerance test. The doctor will give the person a bottle of liquid that has a very high amount of sugar, and then have his blood tested again after 2 hours. Okay, so with the test, if the result shows that it's below 7.8, it means it's normal. Okay, but if this person's blood sugar level is between 7.8 to 11 mmol, it means he has pre-diabetes. If it is higher than 11 mmol, it means he has type 2 diabetes, or for someone that is pregnant, okay, she has gestational diabetes. Okay, so how does our body maintain a normal blood sugar level? All right, I always ask myself this question, so let's explore into it. So the key lies in the insulin secreted by the pancreas. First, let's get to know about our pancreas. All right, in the picture we can see the one that looks like a leaf. That's our pancreas. Okay, this pancreas is an organ situated close to our stomach. Okay, so one of the functions of this pancreas is to secrete insulin to lower the blood sugar level. Talking about blood sugar level, we have to first understand that when we consume a food, it enters our body, right? And it will break down into glucose in our bloodstream. And the pancreas will then produce insulin in order for the cells to absorb the glucose for the body to obtain energy, right? So how does this insulin function to lower blood sugar level? Let's have a look at this, okay? So insulin helps to move this glucose from our blood into the cells for energy, right? So look at the small yellow particles on the left, okay? This part here. These are the glucose in the blood. The ones in the green are the insulin secreted by the pancreas. So insulin acts like a key, okay, to unlock the cells, which are represented in blue. When insulin opens the cell's door, allowing glucose to enter, which is our bodies will gain energy. All right. So followed by, as we learned before, early on, the normal fasting blood sugar level should be 3.9 to 6 mmol, right? Maybe some of you may ask, if I don't eat, will my blood sugar be too low? Okay, that's a very good question. So there are 3 types of cells in the pancreas, which are beta cells, alpha cells, and delta cells. The functions of beta cells and alpha cells is to secrete hormones to balance blood sugars level in the body. So let me put it in this way so that everyone could understand a little bit more, okay? So these beta cells account for about 60% to 80% of pancreatic cells, which is secreted insulins. Alpha cells account for about 24% to 40% of pancreatic cells and secrete glucagon. This glucagon works in the opposite way to insulin, which is a hormone that increases blood sugar in the body, and comes in delta cells, which account for about 6% to 15% of pancreatic cells. It secretes somatostatin. Okay, it's a bit of, biological terms, isn't it? Okay, but anyway, let us see how this beta and alpha cells balance the blood sugar levels in the body. So a lot of glucose, okay, a lot of glucose in the upper vessel, all right, in the picture here, upper vessels, indicating a hyperglycemic condition. That is, when we eat, there will be a glucose in the blood. So the beta cells will secrete insulin, allowing the cells to absorb this glucose, and the blood sugar level will be lowered. Okay, let us look at the left side of the picture, okay? Okay, have we tried when we were so busy, all right, a busy day, and we had no time to eat a proper meal? When we are over hungry, the body will experience low blood sugar, okay? It causes us to shake and sweat a lot, all right? And at this situation, the alpha cells will then secrete glucagon, okay? This hormone prompts the liver to release glucose, keeping the blood sugar levels between 3.9 and 6 mmol. Okay, so followed by, many people will think, so is it just diabetes, just one kind of diabetes, or there are other types? All right, so there are 3 types of diabetes. There are type 1, type 2, and gestational diabetes. How can we differentiate these 3 diabetes? All right, first of all, type 1, which is the pancreas produces little or no insulin at all. That's type 1 diabetes. Type 2 diabetes is the body does not use insulin effectively, or it does not produce enough of insulin. That's type 2 diabetes. Third is gestational diabetes, which due to hormone changes that causes insulin resistance, mostly happen to pregnant women. Okay, so let's have a look at each type of this diabetes in thorough. All right, type 1 diabetes. Okay, it is irreversible. Second, okay, it is usually prevalent among children and young adults where they are born with it. Okay, this accounts for 6% of all cases of diagnosed diabetes in United States. So type 1 diabetes is either hereditary or an autoimmune disease. In this condition, the immune system attacks and destroys the cells in the pancreas, which responsible for insulin production. Without these cells, little to no insulin is produced. So insulin, at this situation, insulin injections are required at a very young age in order for them to survive. All right, let's look at this gestational diabetes, okay? This diabetes can be prevented and reversed, okay? Why I say that, all right? Because during pregnancy, hormones made by the placenta prevents the body from using insulin effectively, causing insulin resistance. This usually occurs between 24th to 28 weeks of pregnancy. In the United States, 2% to 10% of pregnancies have this diabetes, okay? And obesity is also one of the major risk factors. How does a pregnant mother determine if she is overweight? Okay, we can follow the BMI standard provided by the World Health Organization. If this pregnant mother has a BMI of more than 25, she is considered overweight. And if it exceeds 30, she is considered to be obese. Many people have a concept that mothers cannot exercise when they are pregnant, as it increases the risk of miscarriage. Have you guys heard of that? Yeah, I've heard that a lot. So exercise for pregnant women, okay, as a mother is recommended. Imagine if a pregnant woman, mother, does not exercise for 10 months and believe that they need to eat for 2, all right? So she may end up overeating and put on a lot of weight if they consume all, the high fats, high calorie foods. It is easy to put on weight or even become obese. What they need are nutritious foods to boost their immunity. And also it is important for them to keep their weight in check, as obesity increases the risk of gestational diabetes. Okay, let's move on. This gestation diabetes has several health impacts on the newborn. Why is that? Okay, let's look at this impact. First, this baby will be excess growth. If the baby were born about 4 kilograms, it will increase the risk of injury during the delivery. All right, and also low blood sugar. Okay, and followed by some newborn babies have jaundice, okay, and seizure, most likely because due to this gestational diabetes. What is more worrying is the increased risk of type 2 diabetes of the baby in the future. So these are the impacts, if a gestational diabetes, happen to a mom, a pregnant mommy. So many people think that gestational diabetes only occurs during pregnancy. Yeah, but it has a great impact on the mother later on. For example, after giving birth, the mother will have this hypotension. She will have this proteinuria, which is a high level of protein in the urine. This mother will have this visual impairment, also swelling in the face and abdominal pain. She might also having this difficulty in delivery and a higher chance of C-sections. Okay, experts have pointed out that half of those who have developed gestational diabetes will develop type 2 diabetes 5 to 10 years after they giving birth. Wow. All right. So there's something that we have to keep in mind. All right, let's go into type 2 diabetes. Is it reversible? Yeah. Yes, type 2 diabetes can be prevented and reversed. It is a metabolic disorder where our body does not use insulin effectively, or our pancreas does not produce enough insulin. So type 2 diabetes accounts for 91% of all diagnosed cases of diabetes in the United States. Generally speaking, it is possible to develop diabetes from the age of 30 to 40 years old. Okay, so beware of that. And these causes are due to, first, excess body weight, which is obesity. And secondly, is lack of physical activity. Let's look at this picture, okay, to understand further. There you go. Okay, so, sorry. Okay. The differences between one who has normal weight and the one who is obese. The one with normal weight do not have much fats, right? The one and the one that we see in pink color in the picture, those are the fats, okay? And take a look at the one who is obese, which is the bottom picture here. Although his pancreas produces insulin, okay? But he has too much fat, like a thick layer of fats that prevent it from binding to the insulin receptors. And the glucose remains in the bloodstream, leading to high blood sugar. Therefore, obesity is the main factor that causes the body not able to use insulin effectively and leading this person to type 2 diabetes. Okay, some people say that they are diagnosed with diabetes after they have lost weight. Have you guys come across these questions? Yeah, I have. So in fact, okay, why? In fact, this is because they used to be overweight. All right, diabetes is when the cells are unable to take in glucose for a long period of time. The body will then burn for body fats and protein for survival. In this way, the person lose weight. Hence, losing this weight is one of the symptoms of diabetes. Okay, what is the symptoms and signs of diabetes? Okay, all right, we can see here excessive or this urination, okay? And that's why we get thirsty very quickly. Also, this person will feel hungry very easily. They lose weight, their visual changes, okay, may lead to blindness, okay? And they also feel tired very quickly because their body cannot get the fuel energy that they needed, okay? And also, sometimes they might have this numbness or tingling hands or feet. Also, if they got a wound, cut, on their fingers or hand, the healing will be very slow and prone to infection, or even may not have symptoms at all, okay? If we have one or more of these above symptoms that I mentioned, please get it checked, okay, with your doctor, because there is a high chance of getting type 2 diabetes. Many diabetic patients avoid sweet foods, right? Yet they struggle to manage their blood sugar levels effectively. Why? Interesting, isn't it? Because it is not just sweet tasting foods that can elevate blood sugars level. Rather, it's crucial to consider the glycemic index, which is GI, known as GI, of the food that we consume. Okay, let's look at a guideline, okay? This food glycemic index, the sweet food, okay? What is GI? Okay, it is an indicator of how quickly the body digests a particular food and converts it to blood sugar. So the lower the GI, the slower the food causes a rise in blood sugar levels and the healthier it is. So foods that have a GI greater than 70, okay, look at the picture right here, are considered to be high GI food. Take for example, do we think steamed white rice are sweet? No, right? But take a look at the GI. Steamed rice is 89, is pretty high. And cooked potato, 87, is also considered very high GI. Some food are sweet, like apples, okay? Let's look at red apples. How many GI? Is only 34, okay? This is very low. So in conclusion, what I'm trying to say here with the picture, this guideline is, it is not the sweet tasting foods that causes the blood sugar levels to rise, but is the food with high glycemic index. So we might want to check on the, the table of GI for every foods that we eat. Diabetic patients should choose a low GI diet over unsweetened foods. Okay, so different types of sugar have different GI, right? Glucose has the highest GI, 100. So when we take glucose, the blood sugar level will definitely rise very quickly. Sucrose, have a look at sucrose, is 65. Lactose, 46. What about fructose? Fructose, 19, which is very low, but it is very sweet. Yes, it is very sweet. Therefore, if we consume fructose, it would not cause a person's blood sugar level to rise immediately. For example, a sweet tooth person, okay? They love sweet, they love cakes, dessert. We can maybe substitute, our normal sugar to fructose to make our favorite dessert instead, okay? So have any of us, okay, seen some reports saying that fructose has high GI? Why? Because many beverages in the market across the world have added sugar called fructose corn syrup. Although he has fructose in the name, okay, in the name itself, fructose corn syrup, but it is not pure fructose. This corn syrup is one of the cheapest sweeteners. The common fructose is this fructose corn syrup has a fructose to glucose ratio of 42% glucose, 58% of glucose, or the glucose is as high as 55% fructose plus 45% of glucose. Result, the GI is very, very high. Okay, so conclusion, managing our weight and being mindful of the GI of our diet is very crucial. Okay, so which groups of people, okay, are at a higher risk of developing diabetes? Let's have a look. Okay, family history, especially type 1 diabetes, is mostly hereditary. Okay, people who have a parent or sibling with diabetes, women who have developed gestational diabetes, people who lack of exercise, and overweight people, they are higher risk of type 2 diabetes. Okay. Followed by the American Indians, Asian Americans, Pacific Islanders, Hispanics, and Latinos. People with high blood pressure, a person with high cholesterol and high triglycerides levels. Looking at the statistics also have shown that 1 in 5 people over the age of 65 has diabetes. This may be due to the aging, the gradual decrease in muscle mass, and the increase in body fats, which also leads to diabetes easily. One last one, this is very interesting, which is one of the long COVID symptoms is diabetes. Studies have found that those infected beta cells in the pancreas of COVID-19 survivors produces less insulin. And some survivors develop diabetes soon after they recover from COVID-19. So beware of this, all right? The concerning aspect of diabetes is not the disease itself, but the numerous complications it can cause, damaging nearly every organ in the body. Many of us might wonder why. Okay, all right. Because firstly, diabetes will lead to a lower immune function, where overall our defense, cleanse, and repair functions of the immune system is weakened. Thereby, it increases the risk of cancer, autoimmune disease, and infections. As blood flow throughout the body, high sugar in the blood for long periods of time damages every part of the body. So 2 to 3-fold increased risk of heart attacks and strokes. So when the blood vessels are damaged, it increases the risk, okay? The risk of atherosclerosis, where the plaque are prone to build up in the artery walls, followed by the nerve damage, okay? With not enough blood flow to the area leads to increased risk of infection due to slower healing. Followed by diabetic retinopathy, which causes blindness, I mentioned before. This accounts for 2.6% of global blindness, okay? And diabetes is the leading cause of kidney failure. According to Singapore's National Kidney Foundation, 67% of new cases of kidney failure are due to diabetes. Okay. Diabetes with other impacts, okay? In addition to what I just mentioned, the complications, some diabetic patients also face the risk of limb amputation, okay? More prone, and also some people prone to skin problems caused by bacteria and fungal infections. These diabetic patients also, have this hearing loss, diagnosed this Alzheimer's disease, having depressions, dental problems, and difficulty in getting pregnant. Okay, so type 1 diabetes patient, okay, what do they need to do for the lifetime? They need an insulin injections for lifetime in order to survive. And this gestational diabetes, they also need insulin injection. It is recommended insulin injection instead of oral medication, okay? As for type 2 diabetes, doctors will usually recommend to start with oral medications. When the medications are ineffective, doctor will then recommend insulin injections, okay? These oral medications is not recommended as it comes with the side effects, some of which are more serious, including anemia, macular edema, fractures, and heart failure. Okay, all right. So most diabetes can be reversed, especially type 2 diabetes, because prevention is better than cure. So the best way is to go to your doctor and have your regular checkups, okay? For people who are overweight or for people with symptoms of diabetes that I mentioned before, okay? And especially if we are over 45 years old, please get a regular yearly checkup. Early detection of any diseases is easier to receive appropriate treatment. Okay, diabetes can also be reversed if detected early. So, besides regular checkups, what are the, daily diet superfoods that are effective in reversing diabetes? Let's explore in this area. Okay. Psyllium husk. It is a dietary fiber. Fiber cannot be digested and absorbed and has no calories at all. So it is helpful for weight loss or blood sugar control. Psyllium husk contains 78 grams of fiber per 100 grams. It has 70% soluble fiber and 30% insoluble fiber. Soluble fiber lowers cholesterol and controls the rise of blood sugar levels. Insoluble fibers slows down the absorption of carbohydrates and control the blood sugar level. So study has shown that 5.1 gram of psyllium husk consuming twice daily, okay, before breakfast or before dinner, had significantly reduced in blood sugar concentrations after a meal. Okay, so after you go, so we recommend a high dietary fiber intake daily. Let's see, another superfood that can reverse diabetes is soy. Okay, soy, a wholesome soy. American Diabetes Association recommends that soy protein for diabetes. Why? Because comparing to animal protein, wholesome soy protein is 2 times more than meat, 3 times more than eggs, and 12 times more than cow's milk. The lactose GI in cow's milk is 46, while this soy has a low GI of 10 to 23. Soy increases the body's sensitivity to insulin, which controls the blood sugar level. Eating wholesome soy every day is as effective as a drug for diabetes. Because soy contains soluble fiber, helps to slow down the body's absorption of sugar and stabilize our blood sugar level. So wholesome soy. Okay. Soybeans also contains an active polypeptide, which speed up the fat decomposition process, which aid on weight loss, which can reduce the risk of diabetes when the weight is controlled. Okay, and there is no burden on our kidney. In fact, okay, it lower the risk of kidney disease. Okay, third, the superfood that contribute to diabetic is cactus. Okay, studies have shown that cactus can increase the sensitivity of cells to insulin, okay, which can again help to reduce blood sugar levels in diabetes. Experiment of 8-week study in rats have shown that diabetic rats treated, with both insulins and cactus had normal glucose level after 2 weeks, the same as those in the non-diabetic groups. After 8 weeks, researchers quit giving insulins due to hypoglycemia. Normal glucose level were maintained for the next 7 weeks. Researchers also concluded that the blood sugar in diabetics can be reversed by consuming cactus daily with a dosage of 1 milligram per kilogram of your body weight. Followed by this cactus contains more than 10,000 types of phytochemicals that can promote metabolism, decrease triglycerides levels, also prevent high blood sugar levels, and speed up wound healing. This cactus superfood has always been considered as highly nutritious, and now it has been further shown that it can also stabilize diabetic blood sugar level. Okay, the fourth superfood that can reverse diabetes is ginseng. Okay, ginseng, a study involved both type 2 diabetes and non-diabetes participants who received 3-gram doses of ginseng. Both the diabetes and non-diabetes person had a blood sugar level lower 20%, which is a significant decrease than those who did not consume ginseng. So the study concluded that this ginseng increased cell sensitivity to insulin and increased actual secretions of insulin. Okay, next, polysaccharides. A variety of polysaccharide nutrients from different types of mushroom, like cordyceps mushroom, maitake mushroom, shiitake mushroom, and ABM mushroom, helps our body's ability to enhance the production and activity levels of the natural killer cells to prevent infections and cancer. Followed by these fruits. Everyone knows these fruits. Blueberry, okay, is a very rich source of natural antioxidants. It has a very high anthocyanins, okay? The powerful antioxidants in blueberries have retina protective property, which is helpful in preventing diabetic retinopathy, boost our immune system, and help to prevent certain types of cancer. So diabetes is a killer disease that can have deteriorating effects on many organs in our body, which comes with many life-threatening illnesses such as heart disease, stroke, kidney failure, retinopathy, and limb amputations. Okay, especially in today's society with an aging population and an increasing high standard of living, we should choose not to get sick in order to live a healthier and happier life. So therefore, I urge everyone to understand and adopt the correct health regimen to prevent and potentially reverse diabetes. Okay. Last but not least, according to nutritional immunology, to prevent and reverse diabetes is actually very simple. Eat more fiber-rich foods to lower our blood sugar levels. For type 2 diabetes, the chance of recovery is very high with just a daily intake of moderate amounts of cactus and ginseng. Also encourage us to maintain a healthy body weight. According to the diabetes prevention program, losing even a few pounds can help to reduce the incidence of type 2 diabetes because it allows the body to use insulin more efficiently. And in an experiment on 3,234 people at high risk of developing diabetes shows that choosing a low-calorie diet and exercising can reduce body weight by 5 to 7%, thereby delaying or preventing the occurrence of type 2 diabetes by 58%. Be physically active, do more exercise, regular exercise, such as walking 10,000 steps a day. Is that hard? I don't think it is, okay? It helps. And also 2.5 hours a week of, active, active life and doing more weight training if you are exposed to, because resistance exercise can reduce fats and allow the body to effectively using this insulins yet to prevent and reverse diabetes. Okay, do not smoke because nicotine stimulates the body to produce more triglycerides, leading to insulin resistance. If a smoker cannot produce more dose of insulin, he will not be able to control his blood sugar. So another important point, lastly, to get sufficient rest. Lack of sleep can interfere with insulin sensitivity. A study on sleep suppressions in healthy young adults for 3 days found that the person's glucose tolerance decreased by 23%, which proved that lack of sleep increases the risk of developing type 2 diabetes. Because of lack of sleep, our central nervous system becomes more active, which in turn inhibits the pancreas from releasing enough insulin to break down sugar in the body. As long as we practice this above 5 points that I just mentioned, we can prevent the occurrence of diabetes and even we can reverse diabetes. This concludes my sharing today, everyone. Thank you for listening. I hope everyone have learned some knowledge off of it. Hereby, I wish everyone a good health and have a wonderful Sunday. Thank you. I'll pass the time back to the MC.